On the day of your scope, you will enter the hospital through the Polson Tower entrance. From here, you will go straight to the patient registration booth. They will give you some paperwork, which you will bring with you past the coffee shop into the ambulatory care department. Here you will be greeted by one of our unit clerks. She will verify your ID as well as the type of scope you will be having. This is where your ride will leave unless they are required for interpretation, mobility assistance, or with your medical history. The clerk will then point out where to sit next. Another staff member will come along and assist you with changing. You can take off all of your clothing from the waist up. There will be a blue gown that ties up at the back, a brown housecoat to wear over top, and blue boots to go over your feet. Your shoes and all of your clothing can then go into the blue pillowcase and bring that back with you out to the blue chairs. From here, a nurse will come and greet you. They will once again verify your ID and the type of scope you are having, and they will take you to the next section to be admitted. During your admission interview, the nurse will ask you some questions regarding your last food and fluid intake, your medication history, your surgical and medical history, if you have any allergies, if you take any blood thinners and when your last dose of that was, as well as who your ride home is and who will be caring for you for the next 24 hours. If you are diabetic, the nurse will also check your blood sugar at this time. When they are ready for you in the procedure room, a nurse will come to collect you. They will once again verify your ID and the type of scope you will be having. They will bring you into the endoscopy room. They will then hook you up to some equipment, such as a blood pressure monitor. You will get some oxygen in your nose, and they will also start some fluids through your IV. At this time, a respiratory therapist will come in and they will be administering a lidocaine spray. This is to help suppress your gag reflex. They will be doing this lidocaine spray 1 to 2 times, and they will test your gag reflex after. If you have had any problems with lidocaine in the past, please let the nurse or respiratory therapist know right away. When everyone is ready, they will bring the doctor into the room. He will verify the type of procedure happening and why we are doing the test today. If you have any questions, this is a great time to ask the doctor. Once everybody is ready, they will administer some medications through your IV. We give what's called a conscious sedation here. It's not a full general anesthetic, so you will be slightly awake. The main goal with these medications is to keep you comfortable. We also want you to breathe on your own and be able to follow simple instructions if needed. When the medications are being put into your IV, the respiratory therapist will also be putting a bite block in your mouth. This bite block is to help keep your mouth open for the scope, as well as to protect your teeth from the scope and the scope from your teeth. Once the bite block is in and the doctor is ready with your level of sedation, they will start the procedure. You will feel the scope enter your mouth and you will feel some slight pressure at the back of your throat. This is normal. As the scope goes down your throat, try your best to breathe through your nose, as this will make it more comfortable for you. While the doctor is doing the procedure, he has the opportunity to take pictures or samples if needed. If any samples are taken, they will be sent to the lab. These results usually take about 4 weeks to receive. When you are in recovery, the nurses will go over some paperwork with you. They will tell you what was seen during the procedure, if the doctor took any samples, and if there is any follow-up required. Sometimes there's follow-up with our doctor, and sometimes it's with your family doctor. We will let you know which is which. We will also let you know if you need to hold any medications or if you can resume them immediately. The nurses will also test your gag reflex while you're in recovery. They will start with small sips of water. If the water goes down okay, you will be able to eat at the time written on your discharge sheet by the nurses. If you do cough or gag on the fluids, please listen to further instructions by the nurses for resuming eating at home. Please note to be careful with hot liquids or fluids, as sometimes you may burn your throat without realizing it from the lidocaine spray. When you go home, if you are to have any difficulty breathing, sudden wheezing or increase in wheezing, coughing up blood, or sudden fever, vomiting, and chills, please go to the nearest emergency department and inform them that you've had a bronchoscopy done. With the medications that you have received, you will be legally impaired for 24 hours. This means no drinking, no driving, no signing any legal documents, or any drugs for 24 hours, regardless of how sedated the medications make you. Remember to take it easy for the remainder of the day, as you may still be feeling the effects of the medication. Now that you understand the process of a scope, please feel free to ask any of the nurses if you have any remaining questions.